Hello, I'm Matthew Jolly. I'm National Clinical Director for Women's Health and the Maternity Review, and I'm also the lead for the Data and Information workstream. We intend to create the most complete, comprehensive and accessible set of maternity data ever achieved in this country. To that end, we have already decided to remove the opt-out for providers who don't have a maternity information system, so that they will have to submit the maternity services data set in the future. Ultimately, this means that we should have high quality data for the whole of England. We're also arranging for the maternity services data set to be updated annually so it remains fit for purpose. These data can then be linked with other data sets such as mental health and the neonatal data to create an even more powerful data set that can be used for our dashboards and also for the national perinatal audit in the future. While acquiring the data is critical, it serves no purpose if we don't then make the data easily accessible and easily understood. As part of our work, we are going to develop a set of national indicators that will help us identify where there is unwarranted variation within maternity services. We also intend to develop a user-configurable maternity dashboard. Collaborative working with the other work streams is an essential part of the implementation of the Maternity Transformation Programme, and we will be working with the technology work stream on techniques for gathering patient-recorded or service user-recorded experience measures. We will also work with the technology team to develop data that can be presented in a very easily understandable way using the maternity tool, so that service users can understand the relevant facts about their maternity services. I'm very keen to emphasise that we use this data to drive understanding of our maternity services so that we can improve outcomes. That means that we use data as a set, so we look at balancing metrics and don't just chase one indicator as a target. The purpose of data is to drive continual improvement in our services, not to just performance manage an individual hospital. I firmly believe this project will deliver the best maternity data and information in the world, which will help us create the best maternity system in the world.
At NHS Digital, our vision is an NHS paper-free at the point of care. We want to harness the potential technology and provide patients with the information, advice, treatment and access they need to make sure that they take a more active role in the management of their health and care needs. At NHS Digital, we want to develop the digital clinical skills that will allow us to harness the power of technology and information to enable new and better care models. We want to create a digital revolution across all care settings where practitioners are rid of the burden of paper-based administration and have more time to see those that need more care. Our immediate priority at NHS Digital is to improve the delivery of maternity and child services in England. Earlier this year, the National Maternity Review report called for a seamless sharing of maternity information across pre- and postnatal care. The review also recommended that mothers should take a much stronger role in the center of this process, and they should have much greater access to information about their pregnancy. At NHS Digital, we're working very closely with NHS England and our partners to build the information and technology capabilities that will allow the flow of maternity information safely and securely across different care settings. We do this for a number of reasons. First, we want to have clinicians and their patients have access to their maternity records online, therefore removing the burden of paper notes that were being carried around up to now from appointment to appointment throughout pregnancy. Second, we want every minute at every pregnancy appointment to be spent for the provision of care, rather than having the clinician and the patient repeat the same basic information. Lastly, we want to make sure that healthcare professionals have access to the complete clinical history of their patients online, so that they can enable better real-time decision-making and timely action. We hope that by creating those systems, we can provide patients with the comfort of a more personalized and more standardized experience whenever they're accessing care settings during pregnancy. Last, this is just the beginning of a very exciting journey that can only be successful with your contribution.